Hello Dr. and friends, we are from Group B10 who present our student project with title Sexual Counseling Aspect and Patient Sexual Therapy Management. And this is our members in Group B10.
Thank you so much for the opportunity. First of all, let me introduce myself. My name is Rahel Juliana Manurung with the last student ID 030. So in this video, I'm going to tell a bit about the background of our student project. So basically, the sexual dysfunction is a problem that occurs when a person has no ability to fully enjoy their sexual relationship, or a disorder that happens in one phase of the normal sexual cycle response. Based on several studies, it is proven that the prevalence of female sexual dysfunction varies from 25.8% to 91%, where the male sexual dysfunction affects 52% of men between the ages of 40 and 70. The problem of a sexual dysfunction is not only about the desire for sexuality, but also including the anxiety, inadequate sexual education or social skills, and also the poor self-control. And to handle the sexual dysfunction, there's an intervention called sexual therapy. One of the ways of the sexual therapy is sexual counseling, which is a discussion session to talk about the characteristic, attitudes, or behavior of person's sexuality that has been proven to solve 80 of sexual problems if the counseling can be conducted appropriately. So in this student project, we will talk deeper about this sexual counseling so we can prevent the spread of sexual dysfunction problem. That's all for me. Thank you.
Let me introduce myself. My name is Jile Fitria Ateta with the last 3 digits student number 140, and I will be explaining about first the problem foundation. They are what was the history of sexual therapy, what is the definition of sexual therapy, what are the purposes of sexual therapy, what is the correlation between sexual therapy and sexual counseling, what are the purposes of sexual counseling, what issues are addressed in sexual counseling, how are the procedures in sexual counseling, how is the effectiveness of sexual counseling, and lastly, what are the potential negative outcomes of sexual counseling. Then we jump into the benefits of the student project, which is to broaden the knowledge of the readers regarding the topic of sexual therapy and sexual counseling, and also helps as a source of study for undergraduate medicine students. And the purposes, firstly, the general purpose, of course, to know the general information about this topic and its correlation between sexual counseling. And for the specific purposes, it is to answer each of the problem foundations that we have discussed.
Okay, thank you for the opportunity. My name is Valentino Wijaya, with relationship on the number is 116, and I will explain about the history of sexual therapy. In the beginning, before 1950s, sexual problems were usually treated using analytical psychotherapy proposed by Freud, where the concept considered symptoms that arise in adulthood to be problems that were not resolved during childhood. However, in the late of 1950s, William Master discovered a term called sexual therapy, which is a term for a series of procedures and theories in effort to treat sexual dysfunction. In 1974, Helen Singer Kaplan discovered a sexual therapy that integrates psychoanalytic concept from Freud and sexual therapy from Master and Johnson. For her, sexual therapy should be planned based on the current and previous history. Sexual therapy continues to be developed until now and focus on psychosexual therapy, for example, through the sexual counseling. And there are several other models in this sexual therapy. Thank you.
Okay, thank you for the opportunity. First of all, let me introduce myself. My name is Hannah Korestanadin with my 3 last digit number of student ID number is 236. And now I'm going to tell about the definition. Sex therapy, often referred to as sex therapy, is a specialized form of counseling that focuses on addressing and resolving sexual concerns and issues. It involves a collaborative process between a trained therapist and individuals or couples experiencing difficulties related to sexualities. Sexual therapy aims to enhance sexual well-being, improve communication, and address psychological and emotional factors impacting sexual function. Sexual counseling, on the other hand, is a broader term that encompasses various approaches to addressing sexual concern. while sexual therapy is a specific type of intervention within sexual counseling. Sexual counseling may also include educational component, communication strategies, and exploration of relationship dynamics. In summary, sexual therapy is a subset of sexual counseling that specifically employs therapeutic techniques to address and alleviate sexual difficulties, fostering a healthier and more satisfying sexual life.
Hello, my name is Natasha Putri with last digit of my student number 083. Now I'll explain about the purpose of sexual therapy. The general purpose of sexual therapy are to determine whether the cause of sexual problem are psychological, physical, or mixed, assist individuals and couples in resolving issues related to their sexuality, and to maximize functional ability in order to cultivate a fulfilling and healthful sexual life. Then, there are several types of sexual therapy and their purpose. First, cognitive behavioral therapy aims to breaking bad cycles of cognitive, emotional, and behavioral responses. Mindfulness-based therapy helps patients become more conscious and non-judgmental about their sexual experiences. Narrative therapy aims to eliminate the negative view of sex by helping partners access their life narratives and reconstructing the underlying needs and self-supporting responses. And last, education and physical education therapy helps people from their attitudes, beliefs, and values while also providing them with the information and knowledge they need to understand sexuality. That's all from me. Thank you. So next, I'm going to explain about the correlation between sexual therapy and sexual counseling. So sexual counseling is actually a broader term which includes approaches to sexual concerns. They can include educational component, communication strategies, and etc. But sexual therapy is a part of sexual counseling itself, which specifically uses therapeutic techniques to address the sexual concerns. So they are correlated as ways to solve the sexual concerns. To summarize, it is a subset of sexual counseling in which sexual therapy uses like a talk therapy, but sexual counseling uses a much more action-based strategies. And that is all from me. Thank you.
Hello, my name is Lyshanda Bianca Kusuma with the last digits of student ID E025. Purpose of sexual counseling. During sexual counseling, values and norms about sexuality, health, and body are communicated and discussed. The goals of sexual counseling is to help couples accurately understand sex, increase sexual pleasure by overcoming sex-related anxiety, improve communication between partners, and integrate the experience into a healthy and fulfilling sexual identity. Thank you, and next slide.
Good morning, doctor. Good morning, everyone. My name is Asri Bintari with the last 3 digits of my student number are 063. Today, I would like to present about the issues addressed on sexual counseling. The first one is sexual dysfunction. Sexual dysfunction is a disorder of sexual behavior and sensation in the form of psychological or physiological sexual reactions that are abnormal or absent. Sexual dysfunction in both men and women is caused by multifactorial factors. The next one is sexual orientation. Sexual orientation refers to a person's emotional, romantic, or sexual attraction towards another person. So, there are 3 dimensions to sexual orientation that are attraction, identity, and sex of sexual partner, which vary from each individual and can change over time with broader social influences. The third is sexually transmitted infection. Counseling services can be conducted to address the underlying issues that keep patients engaging in behaviors that negatively impact their sexual health, such as patients who experience recurrent STIs or exhibit sexual risk pattern. Okay, next, sexual trauma. Sexual violence, or SV, refers to any sexual act that is performed without consent or is not freely given. There are several consequences of sexual violence on the physical, mental, and reproductive health of the victim. The last one is pornography addiction. Internet pornography provides explicit content in variety of forms, so that the habit of watching porn online can develop into an addiction. Men who preferred masturbation to pornography over partner sex had an increased risk of developing sexual dysfunction. Okay, that's all from me. Thank you.
Hello everyone, my name is Cendrawan Han Santoso with the last digit number 170. General procedure of sexual counseling. The assessment of sexual dysfunction, it is done stepwise according to the International Consultation of Sexual Medicine. It consists of 5 steps that help assist practitioners, such as basic evaluation and history taking, consideration for specialist care, patient sexual education, treatment options, and follow-up evaluation. In basic evaluation and history taking, it is done of patient's sexual history in accordance with his social, personal, and cultural practices. Patient's medical history to establish whether sexual dysfunction is primary or secondary to another disease. Patient's psychosocial history to grasp patient's understanding of sexuality and sexual practices. And laboratory tests can be done depending on patient's individual circumstances. Consideration for specialist care can be indicated in complicated psychiatric or interpersonal problems, specific anatomical or endocrine factors, or failure in diagnosis in initial evaluation. Patient sexual education is done in regards to general sexual function and dysfunction, as well as sexual knowledge and techniques to improve relationship and quality of life between the patient and partner. Treatment options depend on the cause of sexual dysfunction, which can be holistic, such as counseling and lifestyle modification, or invasive, such as medical interventions and surgery. Follow-up evaluation must evaluate a person's sexual well-being regarding treatment and patient's relationship with partner and patient's quality of life.
Okay, we will talk about the procedure of sexual counseling on male sexual dysfunction. Before that, let me introduce myself. My name is G Mahapraja Divasta with my 3 last ID number 02H. So here, the first step is initial treatment. In this step, we will start the session, and then on the end of the session, we will find the causal factor of why patient is came to the clinic or to the counseling. And also, we will talk about the related to the background of patient, related to culture, origin, and others. Next step is open communication. In this step, we will keep the privacy of the conversation. Also, we will build full trust between doctor and patient. In this step, also we can use placement method, which is include permission, include limited information, include suggestion, and also include intensive therapy. Next step is education. In this section, we will give the right education about the patient condition. Also, we need to know the patient condition perfectly. In the male patient, we will give the education about external organs or internal sexual organs. For the example, external sexual organ, we will talk about the penis normal size or scrotum normal location. In the internal sexual organ, we will talk about the erectile dysfunction and also how the ejaculation can occur. Okay, next slide. The next step of the sexual counseling is include exploration of a modifying factor. It's include predisposition factor and also precipitating factor. For the predisposition factor, we'll talk about the memories about the patient, which is include how about the trauma which is the patient had been through. Is include physical trauma and also mental trauma, and also how about the relationship history of the relationship of the patient. The next is the behavioral techniques, which include sex ban, stop start techniques, squeeze techniques, which is in the stop start and squeeze technique is it for the premature ejaculation condition, and also in sex ban it's included for the low libido men condition. And the last step is the evaluation and also follow up. In this section, we will evaluate our treatment or evaluate our counseling process, which is it is effective for the patient or not, and also is there any new complaint for the patient, and then if there's no complaint, also the patient condition is getting better, we can reschedule for the next counseling, which is indicate the patient is getting better. That's all for me. Thank you.
Hello, my name is Ananta Wismaya with last digit number of 198, and now I'm going to explain about sexual therapy procedure for women. Like men, women can also experience sexual problems such as discomfort during intercourse, reduced desire, and even difficulty achieving orgasm. Therefore, doctor must understand the stages in dealing with patient problems. Here perhaps I will touch on several aspects that are emphasized in women's sexual counseling, namely education. which aims to educate about anatomy, sexual response, and common sexual problems. Here, counselor can dispel myths, overcome misunderstanding, and normalize sexual experience that an individual may experience. Next is factor exploration. Psychologically, women are more susceptible to factors that are caused by sexual dysfunction, such as vaginismus, which is triggered by fear, anxiety related to relationship problems, and traumatic experience. This is why consultant needs to explore various aspects of the patient lives, including marital relationship status and sexual history. Next is behavior techniques, and one of them is that can be used is cognitive behavior therapy, or CBT. CBT is a brief targeted form of psychotherapy and focus on the idea that thoughts and behavior patterns can be changed as part of the treatment process. Maybe that's all from me. Next.
My name is Praditia Putri, and my last digit of my student number is 067, and today I'm going to tell about the effectiveness of the sexual counseling. The first one, sexual counseling can reduce the inefficient beliefs of people. Second one, to increase pregnant women's sexual satisfaction. And the third one is to improve the inefficient perception of sexual intercourse's vulnerability. Behind of that, sexual counseling also can increase enjoyment, satisfaction, and also enhancements of the sexual relationship, so it can really be helpful for a couple. Second, to increase the sexual desire, sexual intercourse frequency, also reaching orgasm, and sexual arousal intensity. And the last one, to educating about the natural changes that occur during pregnancy, and also teaching the pregnant woman the appropriate sexual behavior for the couples who has the pregnant woman. That's all from me. Thank you.
My name is Nadia Ernestin, and the last two digits of my student number are 155. So sexual counseling can offer significant benefits in addressing individual sexual problems, yet it is crucial to acknowledge potential drawbacks. Despite its positive impact, the taboo nature of discussing sexual issues can make some patients feel uncomfortable during counseling, and it is potentially raising psychological concerns. Inexperienced counselors and societal taboos may hinder stress and depression reduction, leading to adverse effects. For a couple with a history of trauma or communication problems, sexual counseling may be very challenging, impacting the relationship commitment and trust. Without proper treatment, it can result in anxiety, fear, and depression in patients. Thank you.
My name is Dewa Utami, with my last digit of my name is 098. So sexual therapy or sex therapy is a part of sexual counseling that specifically uses therapeutic technique to overcome sexual problems. The development of sexual therapy began before the 1950s and proposed by Freud, and the concept is in this therapy is analytical psychotherapy. And then the purpose of sexual therapy is based on the type of the therapy. There are several kinds of problems that can be addressed in sexual counseling, and then the sexual counseling in the assessment of sexual dysfunction is done by stepwise according to the International Consultation of Sexual Medicine 5. And the sexual counseling has been proven to be effective, and however, there can be a side effects due to inappropriate treatment. Sexual counseling can cause anxiety, fear, and depression in the patient. Thank you.